Coronavirus, more specifically COVID-19, is an infectious disease caused by the most recently discovered coronavirus. With an incubation period of up to 2 weeks, this disease causes respiratory illness and symptoms such as a cough, intense headaches, fever, and difficulty breathing. About 16% of those who contract COVID-19 become seriously ill. The elusive nature of this virus has made it extremely difficult for people to know how to properly contain it. As a result, the virus has now spread like wildfire. Since the first confirmed coronavirus-related death in January this year, global concern has grown exponentially. COVID-19 was officially declared a global pandemic on March 11th. Now with over 1.5 million confirmed cases worldwide and over 100,000 deaths. My name's Anthony Padilla, and today I'm going to be remotely sitting down with people who have been diagnosed with coronavirus to learn firsthand what recovering from this disastrous virus is like. Is the novel coronavirus something only the most visibly unhealthy need be concerned of? Or is it an immensely contagious and debilitating disease that threatens to expose the cracks in our fragile healthcare systems? Is the global perception of COVID-19 symptoms simply a severe overreaction to an otherwise typical virus? Or is this pandemic something that will have devastating long-term effects on all of humanity? Hello, Carl.
So good to see you, Anthony.
Nay.
Hey.
Katie.
Hi.
Hello. Thank you so much for coming on and teaching me about the wondrous world of surviving coronavirus.
Day 55 of my quarantine.
You've been quarantined for 55 days?
Yes, pretty incredible. I think I'm going to have the Guinness record. I haven't contacted them. I'm working on it.
Before we learn more about the wondrous world of surviving coronavirus, I just want to take a quick moment to mention that 100% of profits from this video will be donated to the World Health Organization, a nonprofit that is leading the global effort in supporting countries to protect, detect, and respond to this pandemic. Donations made to the WHO go toward funding the activities of Strategic Preparedness and Response Plan, which includes putting in place activities to track and understand the spread of the virus, ensuring patients get the care they need, and producing evidence-based guidelines and advice for both health workers and the general public. I'll include a link to the World Health Organization's website down in the description below for more information. And to everyone staying home, practicing social distancing, and taking this quarantine seriously, thank you for being an unsung hero of sorts and ensuring we make it through this as painlessly as possible for your health and for everyone around you. I know it's tough now, but if we all take this as seriously as possible, I truly believe we'll make it to the other side of this and be stronger as a society than ever before. That's all I wanted to say. Now back to learning about the wondrous world of surviving coronavirus. What do you consider yourself, a coronavirus survivor, a very lucky, unlucky person?
A very lucky, unlucky person.
I consider myself a coronavirus survivor, having gone through it.
Honestly, I don't know if I still have it. I consider myself lucky though.
When did you first realize that you had coronavirus?
So I got tested on the 19th of March, and then they called me about 4 days later and they told me that I was positive.
My boyfriend had it first, so he was confirmed on the 9th of this month, and that was before it was really prevalent in America, so no one was really thinking at that time yet. So when he was confirmed, it was only a matter of time before I got it because I had been caring for him and I wasn't taking any precautions because I just thought he had the flu.
We started on the Diamond Princess, which became the epicenter outside of China for the coronavirus. The day of the cruise, the captain informed us that a passenger who had gotten off at Hong Kong 4 days earlier had come down with the virus. So I actually had the virus at that time, but I didn't know it because the tests had to go back to Tokyo and then come back. And by then the State Department had already taken us off the ship, put us on buses, 300 of us boarded buses. It was an all-night process. They took us to a hangar outside of the Tokyo airport, and there were 2 747 cargo planes waiting for us. We had three officials there. They were Air Force in hazmat suits. and one was an Air Force doctor. He confirmed I had a high fever, so he put me in a special quarantine area on the plane where there were already 8 other passengers from the Diamond Princess.
That must have been terrifying.
It was a weird situation.
What were your symptoms like?
A very, very dry cough started, and that dry cough lasted for about 2.5 weeks. That remained a long time. My fever only lasted about 8 hours.
Huge headache, I had pressure behind my eyes, and I was like, you know what? I've had this before, so I didn't really take it too seriously. And progressively through the day, I noticed that my headache got worse, the pressure behind my eye, especially this eye, was like really intense.
It was just a sore throat. I took my dogs out and I was walking down the stairs and I lost my breath a little bit, and that's when I was kind of like panting at the end of the staircase, and I was like, oh no, it's starting, it's definitely starting.
How many days do you estimate that you were incapacitated from COVID-19?
Just a little over 2 weeks.
I would say 2 days I didn't really get out of bed because I was sick. The third day I didn't get out of bed because I was just exhausted.
I got put in a biocontainment room where I ended up staying isolated for 10 days. This room was unbelievable. It had double pane windows with chicken wire over it.
Oh my God.
No one entered it without a full hazmat suit. They looked like Neil Armstrong landing on the moon, complete with a motor on their back to provide air filter. And that was for 10 days.
Can you describe what these tests were like?
Back then, the way they were testing is they would take a swab and stick it deep down your throat, stick it around there for 5 seconds. Then they would do the fun part and stick it deep up both nostrils.
Oh, fun.
Yeah, so it's not fun at all. And then I got 3 bonus swabs. You're gonna love this.
Oh, great, let's hear it.
One swab, 5 seconds at a time, was under each eyelid. And then the bonus one was up my rear end.
Oh, fun. You must have been so excited for that one.
Oh yeah, I took it for the team though.
What was your reaction from your friends and family when you told them that you had coronavirus?
My mom was like, you know what, it's okay, just make sure you take care of yourself, like drink your orange juice, take your vitamins. And my dad was like, no, like you're not serious, right? I was like, yeah, I'm serious. He was kind of worried, honestly. He gets really worried when it comes to my health.
But I don't blame your dad, though. I mean, you're hearing about all these people contracting it, and many of them either finding themselves so ill they have to be hospitalized for multiple days, and then some people are even dying or suffering for multiple weeks. So I can understand why your dad was so worried for you. Mm-hmm. What extra precautions did you take to ensure that the people around you were not catching coronavirus from you?
I made the commitment to do 14 days of my own quarantine at the house when I did come back, to allow everyone to chill.
Was that so that people would be more comfortable with you, or is that because you didn't want to infect anyone?
No, because I wouldn't be able to infect them because I wasn't infectious. It's so you could be more comfortable with me being back home in Santa Clarita.
You mentioned that you carry around CDC paperwork now?
I got CDC paperwork. In fact, I can pull it out here. I have it carrying my wallet.
Let's take a look. Can you explain what it is and what it does and what it says?
It basically says, don't have to make way for the plague anymore.
Oh, it says that you are okay and people can be around you.
Right, that I'm okay. This is for airports and for anything else if I go see another doctor or whatever I want to do. Right. This has their official seal of approval.
Were you nervous about contracting the virus before you contracted it, or did it seem like it wasn't really a possibility at that time?
No, I feel like America just didn't really make it seem like it was really going to be a big issue for us.
Yeah.
Everyone just kind of assured us that it wasn't going to reach us, or that it was going to be handled and not to freak out.
I didn't really take it that seriously, and I was just like, I'll be fine if I get it.
But it became so much more serious after you realized how easy it was to contract, right?
Yeah, after I saw it, I was like, oh, I got it? Like, what?
You're like, oh, this is a very real thing that should be taken very seriously.
I should have taken it seriously, but I feel like also the world wasn't really taking that seriously. Like yeah, there's a lot
Yeah.
going in China and what's going on now, but I feel like the United States, they weren't really taking it that seriously until like recently. And they're like, oh wait, this is big.
Of course, you kind of probably found some solace in being like, oh, okay, there's not really anything to worry about. This is fine.
Yeah, that was totally me.
Do you find that people are treating you differently after finding out that you had coronavirus?
When we were still in Japan and had gone public with everything, we had gotten a bunch of death threats.
Why did you get death threats?
People did not want us to come back from Japan. There was a lot of misinformation at the time on the internet.
You found yourselves being pushed away from much of society out of that fear. You were being othered, you were being shunned.
Absolutely, from the fear and the ignorance of not realizing that they're not going to let me out of there without being 100% sure that I wasn't going to be contagious.
When Trevor first got diagnosed or was diagnosed, he was really, really down on himself and really almost embarrassed of it. For him to kind of carry the burden of really being the first person in like southern Las Vegas, everyone was kind of pointing the finger at him, and it wasn't fair because it was like it was only a matter of time.
Being one of the first confirmed cases in any area, you're gonna have everyone in that area pointing a finger. And I didn't even think of that, you know? He had everyone pointing a finger at him saying, if I catch it, it's your fault.
Yeah.
Was there any step of this process where you feared that maybe you wouldn't recover, maybe you wouldn't make it out on the other side?
There were times where I feel my mortality with this, because if either of them moved up into my lungs, I knew I was going to be in deep, deep trouble.
Do you think surviving coronavirus and your whole experience with all of this will have long-term effects on the way you perceive life?
Absolutely. My least favorite chore is picking up the dog poop.
Relatable.
And I realized being there stuck in quarantine that I missed picking up the dog poop, and would have a very, very different perspective on picking up the dog poop, which I do now. Now that I'm home, I'm picking up the dog poop with a smile.
That's how you know you went through something traumatic. Your perspective of life has changed when you are excited about going home and picking up the dog poop.
Absolutely.
Did you experience people banding together to help you at all?
It was amazing. Every day, people were dropping stuff off to my house. We had to start turning people away because the refrigerator and freezer was so filled to the brim. I couldn't even fit anything else in there.
They say during times of crisis to focus on those who are helping and you know, supporting those in need. And you really experienced that firsthand.
Yeah, definitely.
How do you feel about the way the government is handling this pandemic?
You know, with this whole stimulus bill being passed with, I think, you know, $1,200 to every American, like, I don't know if that's just me being greedy, but I feel like we could do a bit more.
While that's helpful, it seems almost like it's just a really quick Band-Aid rather than a solution to help people stay motivated and not feel this complete sense of dread with their lives right now.
I agree. I totally agree.
How do you feel about certain people calling this the Chinese virus?
It's just igniting anger, and you're just getting people riled up. It's like, what is that do? That's not helping anything right now.
Even back when we had Ebola, you know, things like that, nobody called it the African virus. You know, everybody called it Ebola.
What's one thing you wish you could say to people who aren't taking quarantine seriously?
You've got to take it seriously, because even if you don't become that vulnerable with it, in most of these cases, 80% are very, very mild, the chances are really good, because this virus spreads so easily and you don't know you have it, that you don't want to spread it to others. Stay quarantined, don't go out, because that's the worst thing you could do. You could be killing other people.
Stop thinking about yourself and how much it might suck for you. Think about, like, you're giving someone literally a chance at life by just staying home.
Think about the people who are older, you know, think about the people that you come in contact with, regardless of their old, you know, them going back to their families, them going back to their newborn kids or their mothers and fathers who are older. you know, this may not affect you, but it could affect them.
Maribel wants to know how you feel about certain young people participating in the Corona Challenge, in which some people licked toilet seats or rubbed their face on railings in public transportation and such.
Yeah, that is beyond stupid. It is, there's no words for that.
Wait, that's a thing? I didn't even,
Yeah.
I really tried to stay off social media.
Probably for good reason. I mean, yeah, that's a real thing.
So they're licking stuff to what? Because they think it's a joke?
Because they think it's a joke, yeah.
I can't say it on YouTube.
I can't wrap my head around, like, why you think it's cool to lick a toilet, dude. Like, that's just disgusting. Like,
Just to have their name out there and to get recognition, and they don't care if it's harmful to everyone.
funny you say that, because the girl that started the coronavirus, that's what she said. She said she was upset that the coronavirus was receiving more attention than she was, because she wanted to become viral. And that's why she started the challenge.
It's unfortunate though, because some of these people are becoming famous for it. We're talking about her. You heard her interview afterwards, and all that does is show that it works. So she's going to continue doing that, and she's also going to affect and influence many people around her to do the same thing for fame. These people are even putting lives in danger by influencing people to do this. Has contracting COVID-19 affected any of your relationships in your life?
My relationship with my boyfriend's mom, but I would say that I was definitely like the saddest I've ever been in my whole entire life when I found out that she could have like potentially, it's crazy, like I like get choked up even thinking about it, because knowing that she could have like passed away, like.
Yeah, it put it in a perspective for you. It made it very real.
So yeah, it affected my life because I was really, really obviously sad and worried, but not necessarily my relationship.
What do you think the biggest misconception is about people who have coronavirus?
Everyone else assuming that coronavirus looks just one way. It's not defined in just one thing. Like my boyfriend's symptoms were very different than mine, and my symptoms were very different than his mother's, and her daughter's symptoms. It looks like so many different things for so many different people.
Is there anything that you would want to say to the first responders out there who are handling people firsthand that have coronavirus and are helping to heal them and make sure that they stay safe?
It's really admirable what you're doing, and I thank you. And the people that took care of my boyfriend's mom and were working around the clock to make sure that she was okay, and everybody that's sick right now, it's really admirable. It takes a special person to do something like that.
After this quarantine is lifted, after people no longer consider this to be an official pandemic and you feel safe to go out again, what do you think the first thing is that you'll do?
I would love to go for a bike ride in a really quiet area where there's lots of trees, on a bike path that really gets me in touch with nature and connects that way.
Get Buffalo Wild Wings. The closest one to me is in the mall, and the whole mall shut down.
I actually have a parting gift for you, a Best Interviewer shirt, which you could get at padildoshop.com. But for you, I will ship this to you for free, assuming that you take the necessary precautions and you do not touch the package for the recommended amount of time and wash your hands and keep everything clean. This is for you.
I love it. Thank you.
It looks great on you too.
I feel like we'll look the same.
Oh my God, we do match, don't we?
Yeah.
We both deserve to have a photo shoot on the Brawny packaging, so I'm happy about that. All right, you got 5 seconds to shout out or promote anything you want directly into camera. Go.
Have total information on hometownstation.com along with my journal. I hope everyone gets a chance to read it.
If you'd like to see a more in-depth video on my personal experience while you're staying at home, you can watch it on my YouTube channel at Katie Hodges.
I am shouting out Emma Davidonon because she's the reason why I'm doing this video, and she's amazing, and I love her so much.
I know this man personally, and he's an amazing human being, and you should, of course, subscribe to him.
Thank you so much, Nay. I feel like I understand the wondrous world of surviving coronavirus just a little bit more.
Awesome. I'm glad I come.
After spending the day with these coronavirus survivors, I've come to understand just how seriously this pandemic should be taken, especially considering how much suffering this outbreak has caused for even the healthiest people, and how many people have lost their lives battling coronavirus and tending to those in need. Please, for the safety of yourself and everyone around you, practice social distancing and stay home unless absolutely necessary. For the latest tips and information about coronavirus from the Centers for Disease Control and Prevention, you can visit coronavirus.gov or click the link down in the description. See you later, bye guys.
Press a like.
Wait, so you were tested, they thought that they found the cure for coronavirus and they thought that maybe it was just Gatorade. So they fed you Gatorade.
I kid with the Gatorade because I've been through every flavor of Gatorade multiple amounts of times. The light blue is the bomb. Stay away from the grape because that is nasty.
You must be tired of Gatorade at this point though.
Absolutely. What's your favorite Gatorade flavor?
I had a disease when I was 15 and all I drank was Gatorade and it was Arctic Freeze.
Arctic Freeze is the best.
It's the best one, right?
That's the bomb. Yeah.